This video is an ethical and legal request for your informed consent before undergoing the medical procedure called esophagogastroduodinoscopy, EGD for short. Your doctor at GI Associates wants you to understand why the procedure is needed, how it's done, and will explain potential risks, complications, and benefits associated with the procedure, as well as its reasonable alternatives. To help you better understand EGD, let's start by looking at the body's digestive system. This system is also known as the gastrointestinal tract, GI tract for short. It includes the mouth, throat, esophagus, stomach, small bowel, and large bowel, which ends in the rectum. The upper GI tract is the part of the system that begins at the esophagus and ends at the upper part of the small intestine, called the duodenum. EGD allows doctors to look inside the body's digestive system through the use of an endoscope to examine the internal lining of the upper GI tract. This is an endoscope. On one end is a camera that's guided by a set of hand controls with precise movements. Small openings on one end allow instruments, air, and light to pass through. The endoscope will be inserted into your mouth and guided through the upper GI tract. Your doctor will examine your esophagus, stomach, and duodenum on a monitor as the scope is advanced, possibly pausing occasionally to inflate certain areas with air for a clearer view. The most common reasons for EGD include, but are not limited to, heartburn, nausea, chest or abdomen pain, anemia, bloody stool, vomiting, trouble swallowing, abnormalities indicated on other GI tests, or for the removal of a foreign object. The sources of these symptoms may include ulcers, inflammation, stricture, tumors or cancer, polyps, usually harmless tissue growths, but sometimes precancerous, varices, hiatal hernia, or the protrusion of the stomach above the diaphragm or into the chest cavity. EGD rarely causes discomfort. Prior to and during the exam, your doctor may give you intravenous medications to reduce anxiety and to provide sedation. These medications might make it difficult for you to remember the exam. Some of the risks of sedation include depression of reflexes, decreased breathing, and decreased blood pressure. Side effects and complications are rare but can occur during or after the procedure. To ease the scope's insertion, a mouth guard will be placed between your teeth and sometimes a local anesthetic sprayed into your throat. The spray may have an unpleasant taste and make your tongue and throat feel swollen or numb. If you've given prior consent, your doctor may treat any abnormalities seen during the exam. If stricture or narrowing of the esophagus is present, a dilator could be used to stretch the area. Samples of tissues, digestive fluid samples, biopsies, or cultures may be taken during the exam. If indicated, a small acid monitor, a Bravo capsule, may be placed to measure acid in the esophagus. If a polyp is discovered, your doctor may remove it using a snare or biopsy forceps inserted through the endoscope or colonoscope. Because your GI tract can be seen so clearly, doctors can determine if further testing will be needed and develop a treatment plan for your diagnosed condition. EGD is usually safe and associated with very low risk. However, you should be aware of any possible associated risks. Risks include pain and discomfort, a tear or perforation of the esophagus, stomach, or intestinal wall, bleeding from scope trauma, dilation, biopsy, or polyp removal. Other risks include loss of teeth, hoarseness, cardiac or respiratory complications, reactions to medications, infection, irritation, or phlebitis at the IV site, the possibility of missing a lesion or cancer, and other risks specific to your physical and medical condition as discussed with you by your doctor. Extremely rare risks include death, brain damage, disfiguring scars, paralysis, loss of function of an organ or limb. Because sites can be examined directly, EGD is considered very accurate. Most doctors consider the results cost-effective, most sensitive, and specific with the least risk. However, there are alternatives such as barium X-rays and scans. The decision to undergo EGD is yours and should be based on your doctor's evaluation of your particular problem, as discussed with you. If you decide not to have the procedure, be aware that your doctor may not be able to properly diagnose or treat your condition, which could worsen or possibly spread. If you have any questions about your need for this procedure or about the procedure itself, ask your doctor. This video can be helpful in your right to informed consent, but should not be a substitute for discussion with your doctor.